please.
Yes, Representative, my name is David Bass.
Yes, okay. The second panel. The chair calls David Bass, testifying on behalf of himself, testifying for House Bill 3785. Will you identify yourself?
Yes, ma'am, my name is David Bass.
And state your position on House Bill 3785.
I'm here to speak in support of House Bill 3785.
Great, thank you.
Okay. I retired from the Army in 2006 with 21 years of service. I'm a veteran of Desert Storm and Operation Iraqi Freedom. I am a 60% disabled veteran. When I returned from serving in Iraq with the 1st Cavalry Division, I was diagnosed with PTSD. My military doctors and Veterans Administration doctors prescribed various psychotropic drugs for the symptoms of PTSD. These drugs had terrible side effects. These drugs made it difficult for me to function as a normal person. After taking these drugs for a long period of time and dealing with these side effects, I asked my psychiatrist at the VA in Temple how much longer I would have to take the drug that I was on at the time. He told me that we would not even discuss stopping the medication for another 2 years. I was very frustrated and angry. One day, I flushed my medication down the toilet. I had the courage to take this action because I had discovered a drug that worked for the symptoms of PTSD and had no negative side effects. This drug is medical cannabis. Medical-grade cannabis alleviates my symptoms of PTSD. It allows me to sleep peacefully with no nightmares, reduces anxiety, paranoia, and hypervigilance, and allows me to escape depressing memories and obsessive thought patterns. One of our nation's staunch allies, Israel, was one of the first countries to establish a nationwide medical marijuana program. Studies in Israel have confirmed that cannabis is effective for treating the symptoms of PTSD. Dr. Raphael Meshulam is a neuroscientist in Israel. He is a pioneer in cannabis research. He discovered the effect of cannabis called memory extinction, which diminishes the link between triggers and bad memories. I can testify that this is exactly the effect medical-grade cannabis has on my symptoms of PTSD. Israelis diagnosed with PTSD are allowed to use cannabis to treat their symptoms. One of Israel's most important medical centers, Sheba Medical Center, administers cannabis to patients with qualifying conditions with state-of-the-art vaporizers. Thousands of veterans in Texas use cannabis for PTSD rather than the psychotropic drugs prescribed by our VA doctors. This makes us criminals in Texas. This is not just. We risked our lives and sacrificed our health for our country. We deserve access to a medication that is safe and effective. Veterans Administration Directive 2011-004, which I have provided the committee members, directs VA clinics and hospitals to not deny treatment to veterans with legal prescriptions for medical marijuana in the 23 states that currently have medical marijuana programs. We Texas veterans ask you to make Texas the 24th state to establish a medical marijuana program. Thank you.